Um, Thanks, Matt. Recording in progress. We're going to go ahead and get started with our traditional roundtable with Chancellor Guskowitz. Take it away, Kevin.
Great. Well, again, thanks, Katie, and it's great to be with everyone this morning. I hope that you were able to get some rest and quality family time over the holidays. I know how important that is under normal conditions, but certainly with how challenging this past year has been, I can only hope that you were able to unplug and make quality time for you and your family over the holidays. And really, I'm glad that we were able to meet today and to hear what's on your mind as we prepare to begin this new semester. I certainly know probably what's at the top of your mind, and that's the top of all of our minds, and that is the concerns around the Omicron variant. I want you to know that we have been working tirelessly over the past month with our leadership team and our public health and infectious disease officials and experts. You've heard me say many times that we're really fortunate to have an incredible team here. I will tell you, and Orange County Health Department has been part of the many conversations that we've had. I'll just tell you, how we're gathering information. What we're learning with this variant is that unlike Delta and unlike the original COVID-19, the things change about every 48 hours. And so our experts are constantly in meetings. We were in a series of meetings on both New Year's Eve and New Year's Day. On New Year's Day, I was on a series of calls from about 6 o'clock to 9 o'clock that evening. My wife finally said, "Are you going to come in here and at least be in here to watch the ball drop?" I said, "I promise you, we'll watch the ball drop," although we barely made it to that. But that's only to say that we have an incredible team that's working really, really hard to try to bring the most, pertinent and timely information to the table as we've been trying to make these decisions. And I just want to emphasize, as I met with a group of students yesterday and last Friday, we are hearing a lot from a variety of different constituencies, as you can imagine, and that's why I'm eager to hear your thoughts today as well. And all of our decisions that we're making are to ensure the safest return for our students, while keeping in mind when I say safest, I'm talking about both the physical and mental health of our students. And I will tell you that for every email that I've gotten around the physical challenges that COVID has created, I hear about the mental challenges of isolation and please don't go back remote. It's going to create the challenges that my son or daughter has experienced back in early in 2020. So my point is that we're taking all of these factors in, and I think we've made some important updates to our COVID mitigation strategies. I think you've seen, and I also want to just emphasize that we're one more thing, that we are also factoring in the need for flexibility of our faculty and staff, because your physical and mental health is equally important to us. I know we talk about we're here for our students, and everything that we do is about creating a great learning environment for our students, but you are here in a working environment that you devote a lot of time and effort and expertise, and we need to be sure that your physical and mental health is also at the forefront of these decision making. So I want to just emphasize that as well. But just a few updates. I think we sent a message out on December the 22nd, and a message then again on December 31st in the morning, that on New Year's Eve. And again, we had hoped to. I said that we would notify the campus no later than January the 3rd. We did feel that it was important by the end of last week to provide some information so that the units could begin planning and students and parents could begin planning. So the prior to arrival testing, we announced back on the December 22nd message, this is required for students living on campus and all unvaccinated students. And then strongly recommended for everyone coming back to campus. And we recognize that some of the challenges that's creating as testing has become much more challenging over the past 2 weeks out in the various communities. And we're beginning to hear from some families about that. And that's the call that I was on last night at 9:30 as we're working on some contingency planning around that. You probably saw in the message on last Friday on New Year's Eve, that deans are being given the option to temporarily modify modes of instruction. And this decision came with a lot of thought and deliberation with, and Bob Lewin, who you've just acknowledged and recognized, did an incredible job of convening members of our leadership team and the deans to come to the decision and alongside me and others that this was the best approach. We wanted to provide some autonomy back to units. Some schools have said, we just can't go remote. We can't go fully remote. It's just not going to work. And we wanted to give them the option and the deans to work with faculty who wanted to be back and needed to be back in person and for a variety of reasons, and those that could go remote temporarily. And when we say temporarily, we're being very clear about this. This is a 2-week window. We will reevaluate any course that goes remote for a temporary period of time. It's a maximum of 2 weeks. That'll be reevaluated by the provost's office and considered, to extend that if needed. Our community standards from last fall remain in place. We are strongly recommending that everyone receive a booster, and we're working on the registry so that we can actually determine what percentage of our students have received the booster. Some of them are not even eligible for it yet because they got their second shot back in maybe September, October. And so they're not even eligible for another several weeks to a month to get that to get their booster. But we are considering fully vaccinated being boosted as well. And so that's our goal. We've seen an uptick in the number of people, both faculty, staff, and students who have gotten vaccinated even over the holiday break. Even though we were at a really high percentage, that number has continued to climb over the holiday. We are making that booster available at Campus Health and the Student Stores Pharmacy. No appointments are necessary. And Ken Pittman, who does an incredible job running Campus Health, has been providing daily updates for us. And we've seen an uptick in the number of folks coming in just since Monday. Orange County Health Department, our public health experts have advised us that asymptomatic testing, surveillance testing, really has limited utility with Omicron, given the short incubation period and the high transmission rate of this variant. So we are modifying the asymptomatic testing, really wanting to strongly emphasize the need for anybody with symptoms to get tested. And we anticipate, as we have said repeatedly, that we are going to see cases on our campus. And I think it's critical that anyone who tests positive remains isolated and until asymptomatic, or for 5 days if completely asymptomatic. And that's coming off of the new CDC's guidance. And if you're watching the news over the past 24 to 48 hours, the CDC's been under attack for some of the messaging and the way needing to provide more clarity around that. And our team here, infectious disease team, has said that we're likely to see some updates probably over the next few days, just in terms of them clarifying some of the CDC messaging. In terms of our employees, again, who are working tirelessly, whether they're working fully in person on a hybrid model or working remotely. I know how hard everyone's working, but we are asking managers to be flexible and accommodating to of the isolation period requirements of any of our employees who have been exposed or infected. We do believe, as we have heard repeatedly, and you've heard me say this, you've heard Bob say this, that the best experience for our students is an on-campus with in-person classes, and we want to do everything we can do to make that possible, as long as it's safe to do that. And so, again, I just want to thank you for all that you're doing. Thank you for inviting me to talk today. I'm sorry Bob's not here. I want to, instead of turning this over to Bob, I'm wondering if I might be able to just turn to Becky to see because Becky has been working tirelessly over the holidays as well, and nonstop in meetings the past 3 days with us on campus. But anything perhaps that I've missed that might be good to touch on, Becky?
Well, I mean, thank you, Kevin. That was remarkably comprehensive. I think some of the questions we've heard from folks is a lot of the focus, understandably, has been on ensuring we've got structures in place for instruction with students and faculty. Several of you have asked, what does that mean for staff? We've worked hard to ensure that where we know answers to that has been communicated. There are some things that as Kevin said, we're sort of navigating as we understand what this looks like. We have heard from the system office that we don't anticipate seeing additional benefits adjustments this time around. We don't anticipate seeing adjustments to leave banks. So we've been trying to understand the impacts of the amount of time people have to be out if they get sick. We have confirmed that is 5 days. So that if you are infected or have an asymptomatic positive, we ask that you stay home until you are asymptomatic or 5 days. This is better than the 10-day guidance because we know that leave banks are not full. It's better in terms of leave banks. The most important thing, of course, is safety, and we want to make sure people feel good. But we also want to make sure that if people are sick, they feel inclined to stay home, and knowing that, or if they have an asymptomatic positive, that they will stay home, knowing that their leave bank is not going to be decimated as a result of that. As Kevin said, the single biggest thing you can do is both be vaccinated and boosted. I was sort of struck, there's probably a lot more healthcare professionals on this call than me, or more qualified healthcare professionals than me on this call, but I was struck by 2 vaccines will get you some level of protection, but the amount of added protection a booster provides to the Omicron variant is considerable in terms of lessening the impacts of illness. And so the biggest thing you can do if you've not yet been boosted is get boosted, and we are providing those on campus. Then we are going to continue to watch the workforce capacity and work with units to identify if we need to provide added flexibility in terms of remote work. We do have some limited flexibility that already exists under the flexible work arrangements policy, and we'll invite leadership in organizations to use that as needed. But as Kevin said, our goal is to keep people here. We believe that if people are masking and boosted and vaccinated, that we're doing everything we can to provide added protection, but we'll continue to watch that and communicate with you moving forward. That's sort of what I know at this stage in the game, though certainly, as Kevin said, we're following a lot of it. We're happy to answer questions, hear your perspectives, and if there's other things we need to chase down or track down or update on, we'll go from there. And Katie, I know you've also been working with Amir, and there are plans to do a little bit more of a medical briefing or a sort of a public health perspective briefing, and certainly you'll get the expertise there that you won't get from me.
Thanks, Becky. And if I could just add one more thing, I know there's some questions coming in, Katie, and I'll let you, obviously your meeting, you can moderate those. But I just wanted to add one more thing, that something Becky said reminded me, I think you probably have been reading about this, but I want to just give you sort of the local update here regarding hospitalizations. One of the things that was predicted with this variant was that it's, much more contagious, which certainly has held true. But significantly less virulent, in that it's not creating the need for a lot of hospitalizations and ICUs. In fact, we have been monitoring this regularly. Right now, they're predicting, and again, we have really good modelers, that at the peak of Omicron, we'll likely see about half the hospitalizations that we saw at the peak of Delta, and so that's good news, I guess. And right now in our hospitals across the state, we have 14 hospitals. The vast majority of cases in hospitals and ICUs are Delta cases of unvaccinated patients. And I see Robert nodding because you're in this space, and I'm sure you're getting probably daily updates with your team. But so that's, if there's any good news here, I think it's that we are not expecting, based on the models and what we're seeing, that the hospitals are going to become overwhelmed. No, the bigger challenge we have is a staffing challenge, in that we are worried that with as contagious as this is, will hospital workers, clinicians, physicians, nurses, et cetera, be more susceptible to being infected, and therefore there's a workforce shortage, which we've already seen some of, that would compromise operations at the hospital. So I just want to say again that we've got incredible people working on this, but I think that is the good news, and they are expecting the peak of this to be, the update from Monday was that it's likely going to be somewhere in the neighborhood of the last week of January, first week of February is what they're predicting it, right now.
Great, thanks, Kevin. So questions coming in the chat. Does that include a negative testing requirement at the end of 5 days before returning to work?
It does not, is what we confirmed yesterday.
Laura, I have heard rave reviews of the booster process happening at student stores. Kudos to that team. Agreed.
Yes, thank you. They've been incredible. I mean, and a lot of planning went into that. So thank you.
And then Becky answered my question in the chat about, are we moving to a requirement for boosters? And if so, is the EHS site going to be updated? The EHS site is going to be updated, and will be ready Thursday or Friday to allow booster acknowledgement. And the message will come out encouraging people to upload their cards again, but not requiring boosters. Is there going to be a requirement for boosters at some point? Do we know?
This is a fair question. Many of you had heard the information previously about the federal vaccine mandate, and then we sort of announced it generally and then communicated directly with those who were impacted in follow-up. That federal vaccine mandate has been stayed by the courts and remains in process at this point in time. So we are not moving forward with enforcing it. It was scheduled to go in play or to be fully in place as of the 18th of January. We do expect there will be some movement one way or another. If in fact there is a federal vaccine mandate, that does go through and is approved by the courts, I would fully expect that the federal contract mandate will actually also be extended to include boosters. But until that happens, we as a campus will not mandate either vaccines or boosters, but I would expect that if the vaccine mandate does go in play, it will include boosters.
Right. Teresa says, are we still marching towards mandating the vaccine on January 18th?
We're encouraging everything we can to get people to be vaccinated, but we are not able to enforce while it remains in under stay in the courts.
Right.
Joseph says the testing results have come back extremely quickly thus far. Should we experience a slowdown with the Omicron surge?
Amir was asked this yesterday, and again, they've been incredible turning things around. There's a lot of students already back. They've done a lot of testing, 300 to 400 a day, actually 250 to 350 a day since Monday, and we're going to do everything we can. My guess is that as the volume creeps up, yes, we're probably going to see a little bit of a slowdown, but they're doing that's the beauty of having the on-site testing, is that even a slowdown may push it to a 48-hour return instead of a 24 to 36 hour. Let me also, Katie said something that again jogged my memory. We've had a lot of conversation the past few days about the dashboard. I know there've been a few people asking about when we'll start posting data to the dashboard. Department of Health and Human Services here in Raleigh, we've been on a number of calls with them over the past few days, and the UNC system office are they're convening a meeting to try to determine what we should be posting on dashboards, and they're not so sure that just case counts makes sense at this point. They are so we are going to put a brief pause on that. In fact, I think we're just putting a disclaimer up this morning on the dashboard so those that are going there are aware that until we receive further guidance from DHHS and the UNC system office, we're going to pause on what we will post, and we're also again trying to gather as much information around the number of individuals that are boosted, and we may be able to post that even So just hang tight. If you're looking at that dashboard, I hope by the middle of next week, we'll have a plan in place.
All right, so just a few more questions. How will employees in housekeeping services be informed about positive cases isolating within the residence halls?
Becky, I'm not sure if you want to, I have not been part of conversations around that.
I don't actually know. I don't believe employees would be informed about cases. That I need to check on this one. The last time we had outside housekeeping do some of the work when we had isolation, but we had separate isolation dorms, and now people are in their own spaces. And roommates will stay in the rooms with people who are isolating. So I don't expect that there will be an added extension of communication to housekeepers, but let me find out. That's a fair question, and one I honestly don't know the answer to.
Great, thanks, Becky.
Yep.
Given the increased transmissibility of Omicron, are there plans to require or encourage mask use outdoors as well as indoors on campus?
Currently, no. That we have not. There was a conversation right before the holidays about those that are in larger gatherings, sitting outside at a soccer game, a lacrosse game. Should there be masking? So I know that was a question posed to our infectious disease experts. I think there was some, let's give it some time and think about it. But right now, no, we're not building that into our COVID-19 standards.
Certain lab facilities are already saying expect delays. UNC facilities are still striving for a 24-hour return around, but are experiencing staffing issues as well with the surge. Thanks for that update, Evan. Final question in the chat, is long COVID an issue with Omicron, or is it too early for research to watch this? That might be a question for Amir.
I missed the first part of the question, Katie.
Is long COVID an issue with Omicron, or is it too early for the research to watch this?
Long COVID?
Yes.
Okay, yeah, that's an Amir question.
That's a question for Amir. Speaking of gatherings, do you anticipate putting any limits on event gatherings?
We are in discussions around that. Yes.
All right. The isolation dorms, Craig North and Horton, are cleaned by outside contractors concerning the individual suites. Limited housekeeping staff cleans the public areas of these buildings. Okay, thanks for that update, James. Okay, so that's all the questions in the chat. I'm recognizing we are at time. I'm hopeful, Kevin, that you can stay on for this next part.
Yes.
We have a special presentation from Amy Johnson and Samantha Meltzel-Birdie. So we're going to move into that. Kevin, feel free to stay on if you're available and your schedule allows. So
I will. And if I could just acknowledge Amy. Amy has been working tirelessly with our team as well, with so much uncertainty before us. So Amy, thank you. I haven't, we've been in different meetings the past 2 days, but thank you, thank you, thank you.
Yes. So welcome to Vice Chancellor for Student Affairs, Amy Johnson, and Asad Maimandi, Distinguished Professor and Department of Psychiatry Chair, Samantha Meltzer-Birdie. They're going to give us a little debrief on the Mental Health Summit that happened end of last year. So welcome. Thank you for being with us today, ladies.
Great to be here.
Hello. Happy New Year. Is Amy with?
Yes, I am here. So I'm having a little bit of difficulty sharing my screen. Let me see if I can get it to pop up.
Okay,
Hang on just a second. Is it coming up?
Yeah.
Okay, good. Let me do the slideshow here. All right, can everyone see that?
We can.
Okay, Samantha, I think you are up first. So take it away.
Okay. Well, it's a pleasure to be here today. And we wanted to just give an update of the Mental Health Summit that was a day-long program held in November, which does now seem like a long time ago. And we were really pleased to have very large attendance. You will see here that the staff made up the majority of attendees. So there were 558 staff, which is the overwhelming majority who attended that day, and then faculty and students. And staff were key contributors as panel conveners and members, and served as critical participants in conversations throughout the day. So I just want to acknowledge, it is clear that the mental health issues that are sort of front and center broadly for all of society and certainly for our campus are something of great importance to our staff and something that we take very seriously. And I think the evidence of who came to the actual summit that day and really contributed and participated is clear evidence. So certainly continuing to engage staff in campus-wide dialogues about mental health and well-being of our community is something that's very, very important. And I'm going to have Amy Johnson talk about what are the many different things happening that are coming out of the recommendations of the summit.
Sorry, rookie maneuver. I forgot to unmute. You'd think I'd have that down by this time. Anyway, thanks so much, everyone, for having us. Happy New Year. Nice to be back in meetings with folks and see so many friendly, smiling faces. As Samantha said, we were certainly really impressed with the number of staff who turned out not only to help us lead the presentation, but to participate in the conversations and engage in dialogue that started that day but has continued after. And so one of the things that you see before you here is a slide that not only reflects the key themes and messages that we heard that day, but I think both Samantha and I have heard from numerous colleagues after the fact, and a desire really to stay engaged in conversation. And that in fact is one of the key pieces here. The first that we want to acknowledge is that the voices and needs of staff are diverse. This is not a monolithic group. We represent a variety of departments, of backgrounds, of ethnicities, of beliefs. And so there was not any sort of key common message that I think is a universal truth across this entire group. And that's important. And in fact, you know, I think one really of our strengths that we bring as a community. So want to acknowledge that up front, and what you see here is some, again, some sort of synthesis of key themes, but it by no means reflects the entire breadth of the universe. And one of the things that I do want to stress is that I hope folks were able to participate in some form or fashion on that day, but if for whatever reason you were not, we do have all of the presentations from that day up and available on the Summit website, and you can go and watch them at your leisure. And there is an opportunity for folks to continue to give feedback. So we appreciate that. And even if you want just a sort of refresher of what happened that day, we encourage you to go and check those out at your convenience. One of the big messages that I know Samantha and I were very mindful of from the beginning is, although this summit, excuse me, I've got a tickle in my throat. Although the summit was a deep dive into this topic for a whole day, it was just a day. And there is no way that we could have covered really the breadth and depth of the huge mental health crisis that we have right now on our hands globally in a day. So it was designed as a jumpstart, as a kickoff, as an introduction, and I think really a statement from the university, from the chancellor and others about how important this issue is and how we were going to, you know, dedicate a lot of our time and staff resources on that day to starting a conversation that will continue. And we'll talk more about the specific ways that'll manifest in the future. But we heard that definitely from staff, is that they wanted not for this to be a one and done kind of event. And that is absolutely our goal and focus. In terms of specific key themes, you see the list of them there. I don't expect that any of these will shock anyone. We are all dealing as a staff and faculty community with high levels of stress and burnout, the blending of our personal and our professional lives, needing to balance all of the demands, regular demands of those worlds, in addition to, you know, what I have described as multiple pandemics that we're dealing with right now, the viral pandemic, the mental health pandemic, and a racial pandemic. And all of these things exacerbate one another and contribute and are a major factor. Another key piece was that folks are very interested in conversations about salary levels and compensation and benefits and whether or not increases were possible. Unfortunately, we have some traction now from the state of North Carolina on that, so I think that's some good news. But here again, I expect that those a desire for us to continue to sort of keep a finger on the pulse with how our salaries and benefits packages are matching up with our peers, particularly as we have other entities come into the state of North Carolina and are able to offer really robust bonus packages and things like that. You know, how do we offer something that really makes a career at Carolina compelling? Mental health days and flex work are desired. I know that this is sort of a touchy and challenging issue. One of the things that I think we need to continue to talk about is that many folks have perceived that that mental health days are a day off for students and a day off for faculty, and that the staff don't have a similar day off. Now, again, I think there's a lot of conversation about that. You know, technically faculty don't earn days off as staff do. They don't have leave days in the same way that we do. And, you know, certainly faculty would say teaching is just one part of my portfolio, so it's not really a full day off. But I know that this is a concern. How can we, when we have these kind of break days, how can we make them available for staff? And I know one of the things that I have said to our team in student affairs, just to speak very personally about our unit, is, you know, on those days, please, supervisors, as we can, try to clear the day so that folks feel comfortable taking leave if they want to take that day as a mental health day, because of course that is a benefit that we have as staff that our faculty colleagues and our students don't have in quite the same way. The other thing is a real commitment and an interest around flex work. And I know that we started with the pilots. Those pilots for the fall now have been extended. And I think absolutely the university leadership is taking a hard look at this and considering how could we offer, again, in this context of a really robust salary and compensation and benefits and sort of work environment package, if you will, how we can continue to offer flex work in a way that makes sense, is responsible to our residential mission as a university, and still reflects and understands the needs of our faculty and staff. Role confusion exists. This was one in which I think there was some sort of fluidity, and certainly, Sam, if you have a perspective on this, you know, I welcome it. I think one of the more common themes and dynamics in this was that folks felt as though while the roles were shifting, people are leaving, we were not filling positions, folks were being asked to wear multiple hats, maybe in ways that they weren't quite prior to the pandemic. And so really understanding what are the expectations of my role, and particularly when we add things, is it always a yes and? Could we figure out ways for me to still manage so that I only have one job instead of 1.5 jobs, or, you know, insert your number here, so that I can really be clear about what is expected of me and my role. And then just clear communication, guidance, and resources for our students. I know one of the things that has been most difficult about the pandemic, and the chancellor has alluded to it today, it feels since the start of this that that certainly the dynamics, medical conditions and others are constantly changing and evolving. And as a result, the guidance that we get from the federal government, our state governments, our local county governments, and medical experts are constantly shifting. And one of the challenges in that then is recognizing that it feels like every day is sort of a new day. What am I waking up to today? How can we make sure that we're really clear and comprehensive in our communication in terms of what resources we offer, how we encourage students to access our resources, especially when we need to move, especially if and when we need to move more resources into a virtual space and so forth. So that was another key theme. I think in terms of overarching messages that I would really share too with this group, and certainly Samantha and I have spent some time talking about this, and I think she's alluded to it earlier. We absolutely support our staff colleagues in terms of advocating for your needs through your employee forum leadership. That's an ideal opportunity and a really important role that you all play in the university governance. Make sure that you are continuing to, as we tried to do on this day, keep a finger on the pulse of what our staff need, and help us understand how we can best support the community. Certainly for Samantha's and my part, you know, we have particular roles in the university infrastructure, and my primary position is, of course, to facilitate the learning and development of students. through our team. And so, but I think it's really important that we involve folks beyond just Samantha and I and our colleagues who helped facilitate the summit, and will be continuing to do some work on some of the subsequent events and dialogue that we have here, that we recognize that employee forum and us in our various staff leadership hats have an important function to offer in terms of really communicating what our specific teams need, and working with folks like Becky Mangini and certainly the provost and the chancellor and others to facilitate that. We also encourage you to use this information that we're sharing today as just one data point in our conversations. This happened in November, mid-November. It does feel like, for better or for worse, we've experienced a lot of change since then, and I expect that that trend will continue. And so, you know, we can't sort of treat what happened similar to this is just one conversation or just one day, excuse me, and a broad conversation, but we need to continue to sort of augment it and make sure, again, that we are reading the environment and meeting our staff needs and evolving as their needs may be evolving. Then the final slide we had here is just to talk a little bit more about what we have coming down the pipeline. What's next? What are we going to do to continue that conversation? And so some of you may be very familiar with this. For others of you, some of this may be new news, and I'm glad to offer additional information as may be helpful. But one of the first important steps that we're doing, as you may understand, one of the big areas of impetus or reasons for us coming together and having this mental health summit was that we had a series of tragic student deaths on our campus, and wanted to make sure that we are addressing as a key need, obviously, our students' mental health concerns, and particularly a rising trend in suicidal ideation, and addressing this from a prevention and intervention, a postvention perspective. And the JED Foundation is a national association who is responsible, or excuse me, does a lot of this work and actually develops relationships with colleges and universities all over the country, and typically a 4-year agreement, which they offer consulting services, access to their Healthy Minds survey, which not only gives us good information about what's happening at Carolina, but allows us to benchmark across a number of peers. So we're actually signing on as a JED campus. I facilitated a JED campus relationship at my last institution. It was very helpful. And so we are signing on in February 2022. JED takes partners on it 2 times in the year, in the summer, and then this is their spring version. So we're signing on for spring and taking the steps to do that. So that's an important piece and area of progress that we're making. We're also, you may have heard us talk about that day, in order to extend the conversation, as we've discussed, we want to have a series of seminars that will allow us to take a more in-depth look at some areas that we weren't really able to focus in on when we were doing this sort of big broad-based focus in a day. So we've heard from the community that they want to talk about things like the intersection between faith and mental health, for example, or sexual violence and mental health, or how we meet the needs of certain populations, at-risk populations, and their mental health. So we're going to spend some time in seminars, which I expect will be much different than the summit, in that there'll be probably a 1 to 2 hour seminar session that we plan to have monthly this spring, where we look at those topics and invite special speakers and experts to come and talk and engage, educate us and then engage in dialogue. So know that that's coming down the pipeline. We also hope to host a shorter term, not a full day seminar, but what we're calling the Mental Health Colloquium in the spring at the end of the academic year this year, to follow up on the key themes that we addressed in the summit as outlined by the Chancellor, which of course were crisis services, prevention, and campus culture. And we want to not only sort of talk about, what we have done over the course of the last 6 months or so, then in May, but then to also help frame, all right, and what are we going to focus on for next year? What are the themes that we haven't yet talked about? What are the things that we need to address? What do we see evolving on the horizon that we want to try to get out in front of? So that will be another area of focus for that mental health colloquium. And then we are in the process of launching, we've already sort of done this in a soft way, what we call the Heals Care Network, which really is an opportunity for us to just say, as a community, as a Carolina community, we look out for one another, we take care of one another, we're invested in one another's success. And we want this to be a big tent under which a lot of things can fall. We're already talking about the things like the JED campus relationship as one step in our Heals Care network to reinforce this message and theme that we have addressed at some length about how we can build and grow a culture of compassion and care on campus. And really, this is going to be an opportunity in which everyone will have a role to play, both in terms of leadership, in terms of supporting your colleagues and peers and students and stakeholders, all members of our university community. So we have already extended our mental health first aid that was originally adopted as a contract with the School of Social Work, and has been very popular among a lot of folks. So we've re-upped that agreement and have extended our mental health first aid offering, which was scheduled to end in November of last year and now is ongoing. So that's a great asset. We also are working on how we can make a more robust and ultimately an anonymous opportunity for folks to report students of concern, so that we can make sure that we, when we see something, we say something, and if folks feel more comfortable doing that in an anonymous manner, they can, and then we can follow up with those students to check in with them, extend resources, and make sure that as much as possible, we help them get back on track. And also, we know that we are a large and diverse university, and it's an asset, really, that we have the breadth of resources in the mental health space that we do: clinical, non-clinical, school-based, institutionally based, and so forth. And that's wonderful, because it means that there are lots of different points of entry and opportunities for folks to pursue mental health needs that match what they want, match what will best sort of support their success. Sometimes that is counseling. Other times it is talking with a peer periodically, in order to just touch base and feel as though you're connecting with the community. But the challenge in that is it becomes so much and so dispersed that it's hard to sort of pick and choose. It's hard to know even what's available. And so we're working on developing a mental health hub website, which then the challenge will be making it readable and not so big and so robust that it's hard to navigate. That becomes the flip problem. But creating this mental health hub website that all folks can access and see what are the myriad things that Carolina offers, and what might be the best match for my needs, or the best match for me to refer a student to who's come and talked to me about wanting some peer-to-peer kind of advising support, that kind of thing. But again, the message that we want to reinforce is that this is going to take all of us. There is a role for all of us to play, big and small, formal and informal, and we hope you'll engage with us and be a part of this culture of compassion and care. And so with that, really, I think that's our quick summary. Forgive me, I don't know how we're doing on time, Katie, or whether we have any opportunity for questions, but we're here as folks have follow-up.
Yeah, we can take about 5 minutes for questions for sure. Questions, and thank you so much, Amy and Samantha, for that helpful debrief. Questions for Amy and Samantha? I guess I can start. So the Mental Health Hub website, that's exciting news. I guess I'd love the opportunity to partner and work with you all, the Employee Forum would, to kind of build out some staff resources on that page, both kind of how do I help students in this area, but also to kind of provide a comprehensive overview of resources available to staff. Whether that be kind of the resources that Jessica Pijus always helpfully provides in these meetings, or wellness kind of opportunities, or the EAP, which we always put forward. So I think that would be an excellent opportunity to have kind of a staff focused section of that website to point people to.
Yeah, that would be fantastic, Katie. I imagine we're going to be talking with lots of folks to make sure that, things up there are relevant and timely and appropriate, and it's as comprehensive as we can make it. And absolutely, I perceive that you all would be a key partner in that.
And I think we appreciate the mental health tsunami is widespread, and certainly in terms of the clinical care we deliver broadly across UNC Health, we're busting at the seams. And business is booming as we take care of the general population that we serve, as well as within the healthcare system and the healthcare workforce. And we fully appreciate just how difficult this is broadly. So supporting everyone and then providing people with training and resources on how they can support each other, students, and that kind of training is really critical. So people don't feel like they're trying to navigate that without a roadmap. And we're certainly happy in the Department of Psychiatry to assist in whatever way we can with that. But we know it's a very hard time for everyone, and for our staff and their families. So really hoping that we can get over Omicron as quickly as possible. It is hopeful, if you look at other countries, that this may blow in and blow out soon, which would be really nice, and give everyone, hopefully in time for spring, a chance to catch their breath.
Great. Any other questions for Amy or Samantha? And I wanted to echo again my thanks to both of you for putting on the Mental Health Summit. I know that was a big lift, and I think you guys did a fantastic job of putting that together. And it was a much needed, very appreciated session that day. So thank you.
Well, thank you,
kind.
Katie.
Definitely a team effort.
And thanks to the Chancellor for bringing this to campus and making it a priority. Kevin, we hugely appreciate your support, and Katie, thank you for your critical participation, and to all the staff who attended. Again, I think it's really powerful that it was the staff who really were the majority of attendees that day, and shows how much you care and your commitment to the work we do and to this university. And we can't do what we do without you. So a huge, thanks and gratitude for all of you, and for your courage and resilience on what has been a really tough stretch. So deeply appreciate all of you.
Hear, hear. Yes, indeed.
Yes. And Samantha and Amy, thank you, because you pulled this together in about 2.5, 3 weeks, and it was incredible. And again, our work is not done, but that certainly laid the foundation for how we move forward. So thank you.
Yeah, we're looking forward to partnering with all of y'all. So thank you for your great help with that as we move forward. Okay. Next up, we have Director of Housing Justice, Christine Abernathy, on the work of the Jackson Center. So welcome, Christine. And may I say congratulations on your new position. Christine and I have worked together in the past. She used to be with Habitat for Humanity and helped the Employee Forum kind of prepare and plan for our various builds in past years. So welcome, Christine. Good to see you.
Thank you. And yeah, I was going to say there might be some familiar faces on the Zoom call, because I might have seen some of y'all out on the job site swinging a hammer. But I'm so glad to be here with y'all today. And also George Barrett is here with me as well. George, you want to say hi?
Hey everyone, good to see everyone. I see some familiar faces as well. And yeah, my name is George Barrett. I'm the Executive Director of the Mary and Cheek Jackson Center, and happy to be here for Christine and I to kind of share with you our work and some really cool opportunities coming up.
Well, welcome. Take it away, everybody.
Thank you. So we'll just kind of start shifting our focus from campus to the North Side neighborhood. And so moving a little bit north of campus, we'll talk a little bit about some of the work that we're doing, but also ways that we hope that you'll join us and that we can stay connected through community and housing. So I'll go ahead and just share the little presentation that we have. If y'all have any questions, you can put them in the chat while we're doing our presentation. Or we can also, we'll save some time afterwards to answer. So you can either come off mute at that time, or you can put them in the chat while we're doing the presentation. So again, we're with the Mary and Cheek Jackson Center, and George Barrett is here with me, and he's the Executive Director, and I'm the Director of Housing Justice. And we're just going to talk a little bit about what we do, and then also housing justice work and how it can intersect with all of the wonderful employees at UNC.
So yeah, the Jackson Center, our mission is to honor, renew, and build community within the historic neighborhoods of Northside, Tin Top, and Pine Knolls. And if you're not familiar with these neighborhoods, these are 3 historically African-American neighborhoods within Chapel Hill and parts of Carborough. We are named after Miss Marion Cheek Jackson, who you see in the photo here with the big bright smile. And she was a lifelong resident of Northside and Pine Knolls. She passed away a few years ago. But her motto was, "Without the past, you have no future." And that's very much the motto that drives the work that we do. So when we say our community, some of you, hopefully many of you, are familiar with Northside, Pine Knolls, and Tin Top, but just to quickly talk about it if you're not. These are 3 neighborhoods that are adjacent to the downtown of Chapel Hill and Carrboro. They're also about a half a mile away from campus. So if you go from campus and you go kind of northwest, you'll be going in towards Northside. These 3 neighborhoods, the residents of this community, the historic long-term residents of the community, have ancestors who built the stone walls around the university. Also, historically, and some still today, were the workforce, the main workforce for the university, as well as this is the community that was the hub of civil rights organizing and the hub of the local struggle for civil rights in the 1960s. And that work, that community justice and activism work, continues today. And this community very much drives the work that is happening here. So again, very broad strokes about the abundant history of Northside, but just to kind of give you some idea of the community that we have the privilege to work in. And at the Jackson Center, what we do, we have a kind of 3-pronged strategies to our work. So we do youth and education work, really educating the next generation in K-12 schools, but also a lot of UNC students, around 400 UNC students every year. On the local civil rights education, but also the history and values and traditions of the Northside, Pine Knolls, and Tin Top community, as well as do work to empower the local youth within our community and within Chapel Hill and Carrboro. We do a lot of organizing and advocacy. Recently, we've been doing a lot of work around property taxes, which you might have heard of in like the local news as well as in just the sphere. But we do a lot to organize and advocate through community partnerships, very much on the ground, boots on the ground community organizing for equitable housing and food access around as much as other things as well. And also really critical as our work is celebration and connection. So celebrating the history and the traditions and the values and the spirit of this community and continuing that forward, as well as doing that connecting, especially connecting students and long-term residents. There are many UNC students who live off campus in these neighborhoods, and do that work, connection work through festivals, forums, exhibits, public witness, and very much, again, that on the ground, like intergenerational relationship building that's so key. So one major piece of our work and kind of like what we're going to kind of like localize and talk to you about today is the Northside Neighborhood Initiative. So the Northside Neighborhood Initiative is a broad-based partnership effort to really, when we say control the dirt, it really allows the community to be able to determine the future of not only the larger community, but really specifically around properties. To give a quick bit of context, some of you might know, but starting in the early 2000s, the neighborhood started to see a drastic change in the housing demographic, with outside investors buying properties usually under for what their market value were, and then turning them into rental properties that they would rent to students by the bedroom. And so that created a lot of challenges around quality of life issues, increasing of property taxes, and really kind of disturbing the neighborhood fabrics and the history of the place. So in 2015, the Northside Neighborhood Initiative was launched. And this work really is really critical into being able to retain long-term residents, to prevent displacement of long-term residents and families who have been here for generations. And also, and this is kind of like the specific thing we want to talk with you about, it creates new housing opportunities for diverse families to live close, connected, and proud, and continue this history of this being one of the most diverse, family-friendly, and also historic neighborhoods within Chapel Hill. So when we say live close, connected, and proud, and Christine will talk a little bit after this slide, Christine will talk more specifically of what that means and like those opportunities. We're wanting to talk with you about, this is a great Northside Neighborhood Initiative creates amazing opportunities for, especially for UNC employees, people connected to the university, to literally live close, connected, and proud within the neighborhood through the housing opportunities that are created through the Northside Neighborhood Initiative. And the great things are, is, you get to live close, not just living close to downtown Harborough and Chapel Hill and also walkable to the university, but also you get to live close to places like Northside Elementary, which has been an institution of education within the neighborhood for over 100 years. You get to live close to 5 historically Black churches that were the hub of civil rights organizing and a major hub of community today, and have fostered so many leaders, especially so many Black leaders within our community. You get to live connected to residents like Miss Louise Felix, who's pictured here in the middle. Miss Louise is a lifelong resident of Northside. She has been a domestic for decades. She literally is the most popular person in Chapel Hill. She knows everybody. But also she, like many residents, carries this spirit of like knowing who you are, loving who you are, and just being and living in this place where people look after each other and are connected, and very much living proud. So you get to live in this neighborhood and in these communities that have so much pride in their history, so much pride in what we have done, so much pride in the community justice that we've been able to do over many decades and continue to do, and also so much pride in the close connected nature of our community, especially this Black community that has sustained our neighborhoods through so much and continue to sustain and determine our future. So I'm going to pass it now to Christine, who's going to kind of talk to you about what these specific housing options and opportunities are that we have right now that have been created through the Northside Neighborhood Initiative.
Thank you, George. Like, I just love seeing that photo of Miss Felix. Makes me smile every day. It's hard to have a bad day if you run into Miss Felix. So part of the Northside Neighborhood Initiative is that we acquire properties and with resident input and resident guidance so that the community members are truly building the neighborhood in the way where they are able to determine the future. We acquire properties and then we sell them. So we sell them to folks at market rate, so kind of like the same prices that you'd see if you're on Zillow or Redfin or what have you. And we also sell them affordably. So we sell some to our affordable housing partners, such as Habitat for Humanity, Community Home Trust, and also empowerment. So we have a mix of affordable rentals, affordable home ownership, and market rate home ownership. And we're here not only so that y'all know about the work that's going on, but because we hope that y'all want to continue to connect with us, whether that's through learning more about the land bank, that's what we do, those are the land banking efforts, whether through it's learning about the land bank, whether it's exploring the history of the Northside neighborhood, which we can drop the link for oral histories that we have, but also through physically joining the community. There's such a rich history, as George touched on, with the historic tie of this neighborhood and Northside, Pine Knolls, and Tin Top and the university, and being this connection of workforce housing. And we really want to see this connection continue. And this has been something that we've heard from residents as well, that they want to see this connection continue. And so we have some properties that are coming up for sale, and we really would like to connect with folks and match these homes to folks that are interested in living in the community and who are what we consider kindred spirits who want to participate deeply in this community work. And so that's just a little bit of context, but we do have some houses coming up, and I specifically manage matchmaking work. So I would love to hear from anybody who's interested in living close, connected, and proud, and who's interested in purchasing, whether that's affordably through one of our housing partners or if that's market rate. And so just real quick, I'll just show you a little bit of kind of some of the work that we do. So we purchase homes and then we sell them either market rate or affordably. And so we have a 2-story home that's for sale, and we're hoping to match that within the month. And so just real quick, it's a 3-bedroom, 2-bath. It's walkable to campus. And this was owned by the Parrish family before they decided to sell it to the land bank to preserve their legacy. And what's exciting about this property is that there's a lot of new renovations. So you still get the benefit of a historic house with a lot of ties to the community, but you also get those modern upgrades. So recently it has a new roof, stainless steel appliances, new flooring, updated electrical, and actually new gutters. This photo was taken before the gutters were put on. So we'd love to hear from anybody if they're interested in purchasing this home. And then we also have another house that's in the Lloyd Broad neighborhood. And this is a 3-bedroom, 1-bath. And this home is actually being sold by a community member who said, it's really important to me that we have folks who are aligned in our neighborhood. So will you help us match this home? And so this house is in Carborough, and this area is really rich with history, but also this represents part of the business side of Northside. So we get to see a lot of how business has been built up in the area, and also longtime residents that live on that block. So there's a lot of deep connection with this location as well. And another thing to mention, specifically porches are mentioned here because porches, if you think about Northside, you think people stopping in their cars to have a conversation with you. You think of spending time together on porches. And so this is a deep part of the connection within the community. And so this is mentioned that there's just a really great porch for you to be able to say hi to your neighbors and to stay connected. The last thing to know about these properties is that because of the work that we're doing to prevent investors from taking over the neighborhood, the community has said that they really want to see homeowners and long-term homeowners. So the properties do have a deed restriction, and that basically just means that it has to be your primary residence. And so if you're interested in any of these properties, please get in touch with me. My phone number is at the bottom of this page, also my email address. But if you have any kind of hesitation about a deed restriction, just feel free to reach out. I'd love to talk to you about it, and we can kind of discuss more of the details. And so again, if folks are interested, please reach out. You can also complete a home interest form, which is just basically getting your name on the list as someone who's interested. And you can do that by going to bit.ly/liveconnected. And we'll also drop that link in the chat for you.
Excellent. Perfect. Well, thank you so much to Christine and George for coming by. Any questions for them? Excellent. Well, I think we promised Christine to send out any information that you would like to the listserv. So I'm glad to pass along that information for y'all. Thank you again for coming out today. We appreciate it.
Thank you so much, Paul. Hope to hear from you.
Excellent. All right. Moving on to the next portion of the agenda, our traditional human resources update with Becky Mangini. Becky.
Good morning, everybody. And big thanks to George and Christine. I don't know if they're still doing it or if COVID is interrupting it, but our family are supporters of the Jackson Center, and historically they have done singing telegrams at Valentine's Day time. And I believe George was a performer. Do I have that right?
You have that right.
Yes, he showed up at my office.
Oh, we did. We did. I remember. Yes. Yeah, I remember that.
I have to say, it is definitely an investment you would like to support. So thank you to both of you for being here today. I don't have a big HR update. You did hear some of the things I was talking about related to COVID already, so I'll refrain from providing a big update there. But I do, in the spirit of having some good news in the face of a new year. You all should have gotten a message yesterday outlining that you will be in this month receiving your retroactive lump sum payment for the 2.5% legislative increase. That will be the payment that is for July 1 to December 31st. That will show up as a lump sum in your paychecks this month. And then an additional, not an additional, 2.5% will also be added to your December 31st salary and be put forward moving forward. So I hope that's good news. Following up on the commentary and the mental health stuff, paying attention to salaries. It's nice to be able to say, yes, we're doing that. And while I can take zero credit for doing it, we owe big thanks to the state of North Carolina for investing in all of you and all of us. This payment will be made in January. And then, as you all know, the legislature passed 2.5% in this fiscal year and 2.5% in next fiscal year. So we will be repeating this exercise, though not with a retroactive payment, just a forward-looking one in July. We are, yes, I see Keith is saying they tax my bonus like you're Bill Gates. The payments are actually both taxed and added to your retirement. So the standard retirement polls are being taken. I think many of us were sort of surprised when you hear about a bonus payment and then you see what shows up in your check. It looks a little different, but the good news is we're getting as much of it to you as we can. So, and hopefully this retroactive one will feel particularly big. And so don't spend it all in one place. But the good news is that's coming in January. And then we are still having discussions about whether there is any capacity and what the rules are around whether there's any opportunity to top up on any of the on the 2.5%. That's a campus authority thing. There's no state money for that. So it all depends on what the campus is what units are able to provide. And there are some rules around that. So we're just beginning those conversations. I expect to have more feedback on that moving forward. I think I want to sort of leave it on good news. I often come here with a whole bunch of other stuff. So I'm going to leave it on good news, though I imagine, given sort of everything that's going on, you all may have questions for me. So I'll stop there. I know Jessica's here and she's got some wellness news. Link is on the line as well, and they can chime in if they have additional information. But otherwise, I'll just turn it over to y'all for questions.
Thanks, Becky. Question from the chat. When will HR freeze formally lift?
The HR freeze formally lifted on like December 19th or something like that. So it is officially done. And somebody's asking about the interchangeable leave. I think that ended on the 31st of December of last year. I did ask the system office whether we expected any additional flexibility. And at this point in time, there is no understanding that we're going to get anything more from the state in terms of authority, though obviously if Omicron continues in a way that creates some challenges, we may see some adjustments, and I'll keep you all posted on that.
The perennial question, any changes to adverse weather leave?
No changes.
I think that question comes up every year.
Every year. I actually pinged Link earlier in the week, like, are we going to get questions on when we're going to get our first questions on adverse weather, given that we're seeing snowflakes? So.
Oh, goodness. Chrissy Greenberg, so we can now process upgrades. I'm assuming that's in relation to the HR freeze.
Yes, that is accurate. Yep.
Other questions for Becky? I guess I'll chime in. I know we talked about that we can't really implement the vaccine requirement at this stage, but is there any word on an eventual decision once we are able to implement what the consequences will be in regards to non-compliance?
No, the system office continues to look at that. There's a couple different layers of guidance, and one version of them says it would be a 4-part discussion or a 4-part exercise and discipline. So it would start with a discussion and go through 4 phases before it would go to termination. I think we are having discussions about what options do we have other than termination and trying to understand how that fits in with the federal guidance. And I think that's one of the things that's under review with the stay. So the short answer is no, we don't have any information, but we're certainly hoping to have some clarity, both from the federal guidance and from the system office.
James just says in the chat, wage compression, and I believe that's in relation to now that an HR freeze is lifted, is there any possible plans for addressing wage compression?
I know that is on the docket. There is as part of some of the budget discussions, I know units have been trying to figure out how they allocate resources to address wage compression. And so the exact timeline for that, I don't know, but I know they are talking about it. Yeah.
Another question, will upgrades and new positions continue to require essential actions form?
We're making changes to the essential actions form. So for standard, if you're refilling a vacant position, the answer is no. If you are creating a new position or you're upgrading a position from, say, a budget or a accounting tech to a business officer, and you're adding sort of significant duties and dollars, those will require essential actions. We're working on an updated essential actions form, but we will still be reviewing new positions. Yes.
Any other questions for Becky before we hear from Jessica?
Link, have I missed anything that's important to pass along? I'm guessing that's a no. I have to say, it's really delightful to see all your faces again. And I'm going to share Keith's hope that the option 2 with Betty White is the way it's going to be, and that we're all going to have a good 2022 ahead. I'm at least going to start with some optimism.
Starting with optimism. That's a good place to start. Yes.
All right. Thanks a bunch.
Awesome. Jessica.
Good morning and Happy New Year, everyone. I just wanted to give you a recap of how we finished last year and let you know some things that are going on. So it feels like it's been so long since we've all been together. But in December, we had 34 participants in our 2 sessions. Remember, December and November are kind of abbreviated months for us as far as our wellness webinars, but our most attended webinar was managing personal finances. And this month we're going to kick off next week. Again, these sessions will always be on Wednesday during that lunch hour between 12 and 1. Sometimes they're not the full hour, but they do happen around that lunchtime hour. So on the 12th, the session is being adaptive in an ever-changing world, because of course that's still happening. And then on January 19th, we have a session on balancing work and life, important skills that you can still take away from that. And then on the 26th, we have a new session titled Happiness, a Key to Life Satisfaction. So I encourage you to check that out. Those are all on our HR calendar and also in the Carolina Talent System. And then again, since it has been a while, I just wanted to recap the Jingle Bell Jog with all of you. Some of you I was able to see there, and that was great. Becky made it out. I saw Katie there and a few others, and it was just good to finally see people coming back together. There were about 120 people who showed up at that event, a little bit smaller than previous years, but still a good number considering it was our first event back. And pictures are available. So you may have made it in a picture, and I will drop that link in the chat box for you guys to look at. I did want to let you know, since we're kicking off the start of the spring semester, we will be updating our Helping Heals directory. If you're not familiar with this, it is a list of students and UNC affiliates, including employees, who are looking to help others with childcare, pet care, senior care, whether that be companionship care or others. There's a list of volunteers as well as people who want to be paid for their services, which is how we started out. But we got a generous list of volunteers because of COVID. And so the fall list is still available. We'll be updating this later in February, but the registration, if you or if you know any coworkers or students who want to help out any other employees, the registration will be open until February 6th. And all the information on that is on our website. And I'll drop that in the chat box as well. And I'll send these to Katie so she can send this out to everyone. And then, not to, take away from all the importance of everything that's happening over the holiday break and with the new variants and the mental health and the physical health things that we're going through. But just to keep you aware of the resources that are available to you as they come up, Eat Smart, Move More is continuing to be offered for free until the end of June. So if you've worked here or with the state long enough, you know that this has not always been a free service, but it has been since a lot of our medical services have been online now. So it is covered through that. And those sessions begin next week. So you can go on their website there and choose from the 2 classes that are available. In addition, Eat Smart, Move More has a program called Eat Smart, Move More, Prevent Diabetes. This is available for the cost of $30, but participants get the full $30 back with great participation. And that's for people who are at risk for diabetes, not already diagnosed with diabetes, but have pre-diabetes or have other risk factors such as a family history. And there's a quick quiz you can take on that. As far as the discounts that we're promoting this month, just reminding you that the produce box is still available to employees. If you've not signed up, we lost a tremendous number of participants while we were all sent home to work remotely due to COVID. But we are back, and the produce box is, as an employee, you get a free annual membership, which is normally $20, and $10 off your first box that supports local farmers across the state. And that discount is provided through your state health plan, Blue Cross Blue Shield insurance. So you can find that on the Blue 365 website, and I'll send that to Katie. But deliveries are being made to campus if that's what you prefer. If your building has a delivery site, if it doesn't, please contact me and we can get that set up. And then it can also be delivered to your home, apartment, etc. So that's available to you as often on a weekly basis. And then I'm hoping to share more details with you on a Camp Gladiator discount that I'm trying to finalize within the next couple of days for you guys. And that will be local in the Chapel Hill area for those who are trying to kickstart and be a little bit more active in the new year. Questions? Really good to see all of you. Healthy faces.
You both too. Any final questions for our fantastic HR team? No. Well, thank you. And again, great to see y'all again. Happy New Year. Next up.
I have a question. I'm sorry.
Oh yeah. Go ahead,
I couldn't find my unmute button. Jessica, great to hear a lot about what's going on. I actually wasn't able to attend one of the sessions that was late last year you mentioned. Were any of them recorded, or are the slides available by any chance?
The slides are always available, so just let me know which one you're looking for. Most of them are recorded if there aren't any technical issues. So we do have recordings for most of them, but not all of them. We had a few glitches in the fall, but just let me know what you're looking for and I will get that to you.
Sounds great. Thank you so much. Appreciate it.
Yep.
Awesome. Well, we look forward to seeing you, Becky, tomorrow. We do have a rescheduled Vice Chancellor's Representatives meeting tomorrow that got rescheduled from December. So we'll address the December questions and have discussion around those. And then we also have a regularly scheduled February meeting coming up as well. So see you tomorrow, Becky. Next up, we have our consent agenda. I think I'd like to pull committee updates because we don't have much in the way of new business to discuss today. But we'll keep the November and December minutes in the consent agenda. So do I hear a motion to approve the consent agenda?
Can I pull out staff assembly?
I'm going to pull out all of the forum committees.
Okay.
Yeah. Motion?
I made one change to the notes.
Okay.
One of the months. It went out to the list, so everyone should have seen it.
Okay, so do I hear a motion to approve the November and December minutes with Arlene's revisions?
I vote yes. I motion.
I second.
Second, okay. All in favor?
Aye.
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 Any opposed? Any abstaining? Okay, the November and December minutes have passed. Committee updates. We'll start with communications and public relations. Shane. I know I saw Shane on the call. We sent out an In Touch in December, and we'll probably be sending one out early this year. If you have any submissions, please always let us know. Any updates from book club? See if Brooke is on the call. She is not. Okay, next up, community service. Jacob.
Just a quick update about the UNC Children's Hospital toy drive. It was much more successful than I had dared to hope, especially considering how few people were actually on campus. We did manage to get like a whole four full boxes, and they were quite large boxes that we were able to donate. Plus, obviously, people were donating on the Amazon wish list. There's a picture on our Twitter feed from back on the 22nd, I think, if you want to take a look at that. But I do want to take this time to really thank employee forum members, Rich, Dory, Amber, and Tara. They did a fantastic job. They really helped us get a lot of that work done. And I also want to give a shout out to Micah Elliott, who is not a former member, but has routinely really kind of led the charge on this and did an excellent job on this particular drive this year, especially considering the constraints.
Great job, folks. It's always like one of the best days of the year to act as Santa Claus and deliver presents to the hospital. So it's a good time.
Especially if you get to drive around with Rich in his Santa hat. It's kind of dope.
Awesome. Any other updates, Jacob?
We've got our regular scheduled meeting, I believe, Tuesday the 11th. If you want to join that, we're going to try to come up with something to work forward in the future. I know we've got a couple of ideas that are on the board, but I was particularly just inspired by the Jackson Center, and I want to see what we can reach out and do with them. But we'll talk about that Tuesday.
Blood drive, Jen.
Let's see. Is this our first meeting since we had the drive? I didn't think so.
It is our first meeting.
Yeah,
the drive.
Where are we? I don't even know. So we had a wildly successful blood drive on December 8th of last year, which feels like a very long time ago right now. Collecting over 300 units. It was just a really, really fantastic day. The Red Cross was thrilled. Of course, you'll recall we had terrible storms around that time as well. So it was really a desperate time for blood all over the place. So just a really spectacular day. Thank you to the Blood Drive Committee, everyone from the forum. I saw many of you coming out volunteering and donating blood. We will have our next drive, the regular Carolina Blood Drive, will be the first Tuesday in June at the Dean Dome. And we'll kick off planning for that here in the next couple of months. And we'll look forward to seeing many of you all again.
And shout out that we participated in the partnered with CBS Sports Classic. So while we may not have been victorious in the basketball arena, we were definitely victorious in terms of the blood drive and our success in terms of collection. So we won something.
Yes, we did. We absolutely did.
Oh, thanks, Jen. Community garden, Arlene, any updates?
The only thing is that Claire emailed me that she has gotten at least 1 or 2 volunteers as a result of the InTouch article, which of course makes her very happy.
Good. And I think she also wanted to chat with us about kind of strategies to kind of improve dissemination efforts in housekeeping grounds and facilities. So if folks are interested in kind of brainstorming how best to kind of assist them in that and kind of communicating with those units on campus to kind of smooth and streamline that process, because they've had some trouble, especially since the pandemic, of getting the food to the folks in need of it. So yeah, we'll start with that work now that we're back from the holidays. Thank you, Arlene. Okay, next up, diversity, equity, inclusion. We are currently chairless in that sphere. Antonio has unfortunately left the university for a fantastic opportunity down at the University of, I don't know, I can't remember, but the law school down in Macon, Georgia. So Mercer, there you go. We are very, very proud of him and that opportunity. So if anyone is interested in chairing the Employee Forums DEI committee, please let us know, and we will get meetings for that back on the schedule. Okay, education and career development, Ellie and Laura.
No updates from us at this time.
Awesome. And thank you all for your help in kind of navigating the professional development grant new process with Concur. Yay. No, it's been difficult.
Whatever navigation there has actually been.
Yeah. Okay, let's see here. Membership and assignments. Tiffany said she doesn't have any updates there. Personnel issues, Stephanie and Matt.
Thanks, Katie. Just a few things. Our first meeting is tomorrow at noon, I believe. Shoot me an email if you want to join us, and I will forward you the calendar invite and Zoom link. We are going to have Jen Scott and Daryl Jeter come present to us about, I'm sorry, Daryl is the Director of Emergency Management and Planning, and Jen Scott works with the Clery Act. I'm blanking on her title.
Yeah, she's the Clery Act compliance officer for the university.
Thank you, Matt.
Yep.
They're going to talk to us about Alert Carolina, the Clery Act. We asked them to come and present to us based on a lot of conversation from the camps alert that was sent out about the sexual assaults. There are a lot of questions about how those alerts work and when they have to be sent out. So they're going to come talk to us. So again, that's going to happen at our first committee meeting tomorrow at noon.
I believe it's 10 a.m.
Okay, tomorrow at 10 a.m. Ignore what I said. Thank you,
All
Matt.
good. Yep.
Awesome. And I am trying to get a meeting on the books with myself, Mimi, Lamar, and Neil to kind of bring forward the conversation around kind of housekeeping vacancies and their wish to be involved in that process. So more to come on that once I get something scheduled now that we're back from the winter break. Great. Recognition and awards. Is Natalia on the call? She is. Let's see here. Rules. Any rules updates, Jacob?
No, I've just barely read them all. There's a bunch. No, we're good on that front.
Okay. Staff assembly, Shayna. Shayna might be occupied. We'll skip that one for now and come back to it.
Back. Sorry. Sorry, that was my boss, and that takes precedence. Are we at the staff assembly? Is that where we are? Yeah. Okay, so I'm happy to report that the staff assembly took the charge of the 20% cap resolution from the employee forum. We altered it somewhat so that it became a resolution supporting equity for internal candidates. Same ask, abolishing, any consideration of current salary in a promotionary situation. And right before the break, the staff assembly voted to pass the resolution. I'm not sure if it has gone to the president yet, but it's passed. So that is just a formality. And as soon as Keith knows why I'm laughing. Matt Brody wanted everyone to know that the 20% is not a cap in no uncertain terms. Anyway, we're super excited that that passed. I think that will, there is great hope that the HR team from the staff assembly or the system office, given the resolution in hand and the current work that they're already doing, they are hopeful that that will be changed in February at the Board of Governors meeting. So fingers crossed on that. That's just on the horizon. So yay, good news to report there. And if I forgot anything else, Keith, other than it is not a cap.
No, I'm laughing at Arlene's response to me. She says it's not a cap. If it's not a cap, then it must be a chapeau. So
oh goodness. Oh, that's so great. And I did see your email, and I am glad to help kind of bring that conversation back forward about the alternative holidays resolution. I don't know how receptive they will be to that.
So can I provide some feedback on that?
Yes.
That is on the agenda for next week's next week's chair meeting. One thing that I am going to reiterate to the current chairs and the staff assembly is that as per the staff assembly bylaws, anything can be voted on. So I'm pushing very hard we have a follow-up conversation about that resolution. There is some pushback in terms of what we can or cannot even vote on by current leadership. I will make that reminder in the meeting and see if we can't get more traction.
And are non-chairs able to come to that? Is that?
I have, that's sort of an open thing. When I became vice chair, I opened it up to the executive committee because people were complaining that they didn't have a lot of access to the current chair. So currently, the executive committee is invited. I have never said no when people logged on or wanted to attend. I don't think there's current policy on that.
And I was just wondering in terms of, because I know Adriani kind of came to the first one where we presented in case folks had questions for her, given her in-depth involvement in drafting what we passed. So Adriani, if you're free and available, I'd welcome you to be there so that you can kind of hear the progress and trajectory of.
I would absolutely love to be there. So yeah, if you can, Shayna, send me the info and a link, I'll put it on my calendar right away.
You got it. I believe it's next Monday, and I'll send you the link.
Shayna, this is Charles. I hate to interrupt. Those meetings should be open because of public laws, public meeting laws. I mean, open meeting laws. So there's no reason why anyone, especially another staff member, should not be able to attend.
Okay, great. I think we asked that question before and we were told that the staff assembly wasn't subject to open meeting laws for some crazy reason.
If you look at the laws and how they read, I would beg to differ.
I agree. I agree with you.
And we have people in the School of Government. I'll see if I can find out who may be.
Yeah,
who are experts in that.
I just got through reading a whole lot of that stuff as taking over the parliamentarian position, and you're going to have to really convince me that there's some weird kind of exception to that rule, because any committee of a public body of a public is subject to it. It's like there has to be like an aggressive like exclusionary rule for that to be the case. And
I mean,
maybe there is one, but I'm with Charles. That should be open.
Yeah, I sat in on the faculty assembly meetings. The faculty assembly, there was no problem with me being there. Mm-hmm. So I don't understand why staff assembly would be any different.
Yeah, I mean, like that small committee can move into closed session if they wish, but they still have to open it and then go into closed session. And by law, they have to give the reason for moving into closed session. And if it's not an approved reason, they're not allowed to do it.
Yeah. Great. I think that it would be awesome for somebody to bring that up at the chairs meeting.
If somebody definitely questions like why others are there, I will say we are subject to open meetings law.
Well, I think
do you have a parliamentarian as part of the staff assembly, or do you have a position within that role who keeps y'all according to procedure?
We have a parliamentarian.
Yes.
I would enlist them and remind them that that's their job.
Got it. I think I will submit it to HR for the HR update. Submit it as a question, then maybe they can address it at the chairs meeting.
Awesome. Stephanie had to hop off. She says, nice to see everyone. Another plug to email me or Matt if you'd like to attend personnel issues committee meeting at 10 tomorrow. Okay, any other staff assembly updates? Cool. Wait, I do have a question. Shayna, do we know when the next full body staff assembly meeting is?
It is in March. I'd have to look up the exact date.
March. I don't think that they've announced details of it yet, whether it'll be in person or remote or whatever. I'm assuming remote at this point, but
I'm going to assume it's remote.
Awesome.
But I don't know.
Fingers crossed. Okay. University committees, any updates from advisory committee on transportation and parking, or is that Laura still, or is that now we transferred that to someone else, correct?
So we transferred it to Shane, I believe, and evidently the committee was meeting without sending invitations to me, or I guess Shayna, because Shayna, I think, I don't want to speak for you, but it sounds like you weren't aware of their meetings this fall either. Cool. Anyway, so we received meeting minutes from that, and I've put them in touch with Shane, so I don't know if Shane's still on.
Yeah. I got an email in December, late December. I got to reread it, but just saying that thanks for being put in touch.
Presentation.
And yeah, now I'm
Cool. Thanks.
on the committee. So
Glad you're connected now.
I will process all of that and hopefully have some information in the future.
Yeah.
Awesome. Buildings and grounds, James Stamey, are you on the call, Sarah?
Can you hear me?
I can. Hello.
Hey, we met December 9th to discuss the Keenan Stadium expansion, or not the stadium expansion, the Keenan Center expansion. And I apologize, I've been hoarse and sick. What this will do when it goes through all the proper channels, will provide a patio grill area for the student athletes, mini basketball court. But the biggest thing is it will upgrade our training facilities for our student athletes, trainers, sports medicine folks.
Gotcha. Good to hear. Thanks for that update, sir. Carolina Peer Support Collaborative, Natalia or Joseph? Any updates from y'all? I think they have a meeting next week, next Tuesday, if I'm not mistaken, or next Monday.
We've been talking with them about some of the mental health hub and like providing resources. I think you may have heard about tying in some improvements to the employee forum website, although we've directed ourselves towards more of the IT side and other kinds of improvements just based off of the types of resources that we provide. But we're kind of working with that.
Excellent. Thanks for that update. Policy review, any updates from Phil or Jen?
Yeah, I just dropped into the chat a link to a policy that the committee reviewed in December. This is basically for the changes are basically related to SHRA employees who also teach for an academic department, or I guess on the other side of things, if you process faculty appointments for SHRA employees who are teaching in an academic department, this is just a new process that you go through to make those appointments happen. Just a side note, for folks who have submitted policy through Team Dynamics, Matthew Teal has been doing a lot of work behind the scenes to help improve workflow in the new system, and just wanted to kind of shout that out, that if folks are waiting for wonderful changes for the policy submission process and the associated workflow, that looks like it's well on its way to being a real thing.
Great. Thanks for that, Phil. Student Stores Advisory Committee, David or Evan, any updates from y'all? I don't know if David Bragg or Evan Marsh are on the call. No updates there. Okay, Executive Committee, no real updates there other than we have our regularly scheduled meeting coming up later this month on the third Tuesday of the month. So yeah, okay, that is our committee updates for this month. No old business or new business technically on the agenda. I guess I'll open it up here for anyone to bring forward new business or discussion. Feel free to raise your hand, put anything in the chat. I'll start with, I sent an email out yesterday about adding questions for Dr. Barzin in terms of clarifications or kind of expounding upon the university's decision-making in terms of spring return. So feel free to add any questions y'all have for him. I still don't know the format in which this is going to take place, whether it be a webinar, a video where he addresses some of those questions. I really am not sure. So once I hear from Neil and Dr. Barzan, I will be sure to pass along the information in terms of how we can kind of participate in that. So feel free to add questions around COVID and the spring return there so that they can be addressed. No real deadline that I got, but I would try and maybe get them in by end of day today so that Dr. Barzan has time to address them. Any other updates, questions, pressing things for as we start off the new year in 2022? We also at some point will need to do our annual town hall community meeting that's required by our bylaws. So at some point we'll need to start planning for that. Keith, my executive committee, any folks want to kind of take the lead on that and brainstorm kind of where we want to go with that conversation? I'm open to ideas on that front. And then also, this isn't in this term of the employee forum, but in next term, in October of this year is our 30th anniversary. So we'll also be planning probably pretty far in advance for that as well, which that's a Tiffany conversation. I know she had to drop off early. So yeah, those are my updates. Any other kind of new business that folks want to bring forward? No?
I'll think of it 10 minutes after the meeting ends.
I think that's how that usually goes. Yeah. Oh, goodness. All right, y'all. Well, unless there's anything else, I would welcome any motion for adjournment if folks want to bring that forward.
I move to adjourn. This is Arlene.
A second. This is Eliza, and Happy New Year again, everybody.
Happy New Year. All in favor of adjourning for the day?
Aye.
Aye.
And hopefully be a happier new year.
It already is.
It's happy just seeing all of y'all bright and shining faces.
It's a great way to start it off. Thanks.
Excellent. Any opposed? Any abstaining? Cool, cool. All right, y'all. Have a good one. We'll see each other either at the executive committee or chairs meeting for the staff assembly or some meeting in the near future. So good to see you all. Happy New Year. Hope you all had a very restful and restorative break.
Bye, y'all.
Katie, well, I've got you as everybody runs away.
Yes.
First off, I'm very sorry that I was late this morning.
Oh, no worries.
I just had the calendar still set up as the 9:15.
No problem at all.
And I was like, oh, right, we've changed the start date, but not the meeting invite. Whoops, 9:05. Let's see. Oh, there are. Yeah, I hope we moved into closed session correctly. I don't care.
I think we did. And I think Phil was there to kind of help me make sure I didn't.
Yeah. As long as you open like usual and then you move to it and you explain your reasoning for it, then you're fine.
I don't think we did that. So we might not have done that.
I mean, again, I seriously doubt we're ever going to get called to the carpet on it, but parliamentary procedure does require opening before you go into closed. So you have to open the session. Someone makes a motion to go into closed session and they generally have to state the reason. They do not have to state the specific reason, but they do need to state the specific subclause. In our case, it would be A2 to maintain the anonymity of a promotional or scholarship or something like that.
Well, I did not do that.
It's fine.
I did let people know like that we put into the waiting room, this is what's happening. So
sure. And again, the primary purpose of that rule is to avoid the appearance or the action of going into closed session to avoid records being made, and even things that are done in closed session have to be eventually, the spirit of it need to be recorded in its minutes.
Yeah, and we literally read the resolution we passed.
Right, exactly. So like I said, there's no way in the world that we're in any trouble. But yeah, you have to open it before you go to closed. And then
like
you have to motion back out of closed.
Voted on something by like, action item 1 or anything.
Right. But yeah, you generally can't, like, when your agenda says closed session as item 1, no, it needs to at least always be item 2. But I did also just get through scanning through the UNC Assembly Staff Assemblies charter and bylaws real quick. There are specific references in the charter and in the bylaws that you will uphold the North Carolina open meeting laws. So, and the way that that's worded is the assembly meetings. Every meeting other than that counts, because every meeting that is considered technically a subcommittee. Even if it's the meeting of the chairs, it is still considered an assembly meeting. So they are still required to follow open meeting laws. They can go into closed session like usual. And also later, further down in describing the parliamentarian's position, they do specifically reference Robert's Rules of Order, which means that if something has been made motion and a second is made, it's votable.
Yeah.
That is the nature of it. Now, someone can call it to immediate, you can quash it, you can table it. There are things to do it so they don't have to vote on it right away. But the chair does not get to act as a dictator. Traditionally, the chair is a moderator, a facilitator.
Yeah.
So if you're having pushback from the chair being like, you can't do that, first off, chair's not allowed to make that decision.
Yeah.
Chair can call it out of order if they want to. They can try to squash it. They can, they can organize around it outside, or even call for a vote. They can call for a question immediately before you have a chance to make your case. There's ways they can screw you. But if you get a motion in a second, you have to either close it, table it, or do something. You've got to get rid of it. It becomes actionable at that moment.
I would definitely brief Shayna on all of that so that she has that in her kind of,
I just want you to have, because as the chair, don't you have some relationship with the staff assembly as well?
Yes, I do, but Shayna's getting a lot of pushback in terms of her being vice chair, in terms of how their procedure is unfolding, and I think that that's kind of where some of the pain points are. So. Yeah,
no, I mean, if they're doing Robert's Rules of Order, which it references in the parliamentarian's position, it says bylaws and Robert's Rules of Order, which means, and again, I can't find a system where the rules are stated. Ours are online to open it up, but yeah.
Their website is atrocious, so.
So yeah, it certainly seems like they're expected to do that.
Awesome. Well, thank you as always for your trusty help. Awesome.
We'll reach out to Shayna to see if she needs further. I've been DMing her throughout this, so she's at least aware that she's got that in the bylaws, but I wanted you to know you had it in the bylaws too.
Awesome. Matt, I think we're good to close unless you had anything else for me.
No, I'm good. Just wanted to check to make sure if there was nothing else you needed.
I'm good. I think we're good.
Okay. Well, I'm going to go ahead and close the meeting down for everyone. So take care.
Take care. Have a good week, everybody.
You as well.